1 in 5 Americans suffer from chronic pain. Many are now using CBD for relief.
Activists are hoping pot could be legalized nationwide by the end of 2019.
When we look at premium cannabis, the Illinois House approved legalizing recreational marijuana.
Welcome to The Budding Report, a weekly show centered around all things cannabis. Please join us in welcoming our host, founder, and CEO of Budding Capital Investment Group, as well as Simple Changes, a CBD social selling company, Charles Horton, and his co-host, Melissa Nasits, as they share the latest in cannabis news, conduct interviews with top leaders in the cannabis space, and promote some of the latest in science and innovation. And now to our host, Charles Horton.
Good morning, everybody, and welcome to the Budding Report. I'm happy to have you here. Melissa is joining us from San Diego and taking time away from the beach. Dr. Shaw is joining us remotely from his offices as always. And our guest today is Kim Stuck, who used to be a regulator in Colorado when they first came out and now has her own consulting business, and she's taking on both positions in the show. So she's going to be talking about her regulator role in the first part and then her consulting business in the second part. Melissa, how's San Diego?
Oh, it's amazing. You can't get better weather. It's perfect. So it's quite a bit's closed down, unfortunately, but the beaches are open, and that's the main thing. So I'm happy to be here. Nice break.
And you got some golf coming up tomorrow, I understand?
Yep, tomorrow morning. Got a good early tee time, so looking forward to that too.
Well, I miss your energy being here live, but I'm glad you get to be in San Diego and enjoy the beach and golf tomorrow. Dr. Shaw, how are you doing today?
I'm good. How have you guys been?
I'm doing fantastic as well. I got eaten up by ants yesterday. That wasn't a lot of fun. So first of all, again, our guest today is Kim Stuck of Allay Consulting. She's going to be on. We'll do a better introduction of her in just a minute. But first of all, wanted to talk a little bit about the news of the day. News came up yesterday that cannabis is surpassing like even the MBA. So if you look up on your screen, the estimated size of recreational and medical cannabis sales in 2020 is going to be 37 million. Prescription pain medication, I was surprised by this, is about half that at 16.1 million. The NBA is 8.8 million. Toothpaste is 3 million. So I'm really excited to see that weed sales are coming up so high. And the number one thing that I'm looking at that I like to see is that it's double what prescription pain medications are. I'm looking forward to being able to do a lot of different things with the plant and getting away from pharmaceuticals. Melissa, what do you think on that?
I think it's phenomenal just to see. I mean, the one that really stood out to me again was, like you mentioned, the fact that pain medications are getting so further down the list. I think that people are recognizing the uses, especially when it comes to medical with CBD and cannabis. And if we can use something that doesn't have the addictive qualities, I think that overall, health-wise, we'll be in a much better state.
Dr. Shaw, when I had you on last, we didn't talk a lot about the work that you're doing with recovery. Can you touch on that a little bit, on how your work is taking hopefully away from prescription pain medications?
Yeah, certainly. So there was an interest in CBD specifically, its ability to be useful for treating symptoms of opiate dependence. I think eventually it will extend to other drug addictions. And there were some recent publications demonstrating use of high-dose CBD on patients in terms of maintaining abstinence from heroin weeks after they had discontinued use. I took it further and actually used CBD to detox a patient off kind of the last stages of methadone-based treatment for their opiate dependency. That's going to come up in a publication probably in early August, which I hope will set the groundwork and really start to influence additional kinds of treatment options for opiate addiction.
That's so exciting. I just love the work that you're doing. Kim, you've been in this since the beginning when Colorado was legalizing it. What do you think of all of the progress in both recreational and medical sales?
I think it's incredible, and I'm not surprised at all. quite honestly, anybody who's been using for a long time or anything like that, they really realize that the benefits of using cannabis instead of prescription pills, it's phenomenal. You know, you don't have as many issues coming off of things, being addicted to things, and it is a really great pain treatment. So I'm not surprised at all, and I think it's really great that people are realizing it. Also, the age group of people who are starting to use cannabis is much higher. I mean, even my grandmother who has arthritis is starting to use CBD and things. And I think that, you know, if you can find a better solution with less side effects and less bad things happening to your body, why not? So I'm not surprised at all.
My mother is 87 years old, and I gave her some samples to try, and she tells me that pain in her hands went away right away, and so she's calling me every month to get more in. So, you know, my mother's really, you know, she's not a big believer in new things that are coming on, and she's definitely getting the benefits of it. That's fantastic to hear. Kim, what do you think that the regulators are thinking? Are they looking forward to the potential medical uses of the plant?
I think they're still confused. There's a lot of bias in the industry, and when you talk about regulators, you know, whether you're talking about federal or local, you know, different local regulators have different biases as well. And I think they just don't understand it or know that much about it. So it's an intimidating thing. I did not know much about cannabis at all. I grew up in Colorado, so I knew what it was and how it works. But when it came to, you know, extraction processes, post-processing processes, all of these things, it was very intimidating when I first walked in the door of an extraction lab. And didn't know what was going on. And so I think that a lot of regulators are at that point. And a lot of them are getting more curious and reaching out to other jurisdictions to learn about cannabis and the processes and things like that. But I think right now it seems a little overwhelming to most of them. But eventually, you know, they're going to learn and that'll go away. And it'll be just a regular commodity, just like every other thing, like wholesale food manufacturing.
I'm so happy to hear that they're at least open to the to the possibilities that are out there. Well, we're going to go ahead and take our first commercial break, and we'll be right back to jump in with Kim and hear all about compliance and what she's doing, and as a regulator, what she saw. So we'll be right back after this message.
Oh, wonderful. Welcome back. Again, as Charles introduced Kim, she is founder and CEO of Allay Consulting. She's also one of the first marijuana and hemp specialists for public health authority in the nation. She's certified in food safety. She's a quality auditor and a leading expert in cannabis food safety. I know she speaks at cannabis and hemp conferences often, member of multiple regulation workshops, and helping keep the government fair and effective for regulations in the industry. I'm really excited to hear more about what you do, Kim. I know that Charles has got some great questions for you as well. So welcome to the show. We're really glad to have you today.
Yeah, thank you so much for having me.
So let's just start out. So what do you think is unique about the cannabis industry as opposed to other industries you've worked in?
Well, what isn't unique about the cannabis industry? The people are different than most other industries. The product is different, obviously, and it's brand new. It's a very innovative area. People in this industry come up with new ideas constantly. And, you know, from suppositories to tampons to injectables, I mean, every day there's something new to think about. And how should we regulate that? And how do you make a safe product when you have all these innovative people out there coming up with new stuff all the time?
Wow, I try to stay in touch with the industry, and I haven't heard of some of those products.
Yeah, we get a lot of calls. Hey, how do we do this?
So what are you most concerned about with the future of the industry?
Well, I am very concerned with big pharma getting involved. I think a lot of people are very worried about that because most of the companies that exist right now are kind of mom and pop. They started from the bottom. They've been in cannabis for a long time. They have a true love for the plant and what it can do for people. And, you know, when you start getting these big corporations involved, sometimes that, you know, those people kind of get washed away. And I'm really hoping that that doesn't happen in this industry, even though that's going to happen a little bit no matter what. And it is kind of good for the industry because that level of professionalism with those types of investors and clients and things like that is always a good thing. But yeah, I mean, it's just a matter of where it goes and you know, it really depends on what is going to happen. So much is up in the air because we just have no idea which way it's going to go. We don't know how regulations are going to happen. And that's obviously the other thing I'm concerned about. As you said, I'm on a whole lot of different boards helping write regulations and influence the way that regulations are going. I want them to be regulated because people aren't very capable of regulating themselves, as we've known from hundreds of years of experience. But the regulations have to be fair, and they have to, you know, they have to be, you know, people have to be able to follow them. And right now, because the regulators, not the regulators, the law writers don't know anything about cannabis, a lot of times they over-regulate without even realizing that they're doing so. So I'm really trying to stop that from happening.
So I've met a lot of really strong, wonderful women in cannabis, and I know you're known as one of the top leaders in cannabis. In the news right now, they're talking about that the cannabis industry, came out yesterday, could be kind of racist, and they need to that needs to be addressed. So what trends are you seeing when it comes to diversity and inclusion in the industry?
I kind of agree with that statement. When I first started out as a regulator, not when I started the business, it was like 61% of all cannabis CEOs were female. And that was one of the things that really excited me about the industry. And this was just in Denver, Colorado that I'm talking about, because those are the only numbers I had at the time. And I was so excited that, you know, this is a brand new industry. It's a brand new platform. CEOs aren't always men and their assistants aren't always women. You know, we can change that right away from the beginning. And I was really excited about that. Within about 4 years, that number went from like 61 to about 15%. In that time, I don't really know what happened. It was probably a whole lot of other factors. And, you know, when it comes to just equality in general, our country isn't very good at keeping that line. And there isn't a perfect solution either. So, you know, when it comes to diversity, female-owned business, minority-owned businesses, we are in huge support. Obviously, Allay Consulting is actually a female-owned and female-ran business right now. And it is, you know, we do have to think about all of the other women in this industry and really help lift them up, and other, you know, minorities. I am Caucasian, obviously, but we know that, you know, looking around, there are more white men in suits nowadays than there are the people that we usually work with, which were heavily minority based. So, you know, it is changing, and I'm hoping that there will be certain laws and rules put in place, and other people like my company that really is trying to empower those people to be able to own their own company and really live the American dream the way that it should be lived.
I concur 100%. I think that, you know, I've seen a paradigm shift happen over the course of just the last few years. And I think a lot of that is people following the money. I think when an industry starts actually showing profitability, more people are going to become interested in it. And the deeper pockets tend, unfortunately, in this country to be white businessmen. So I think that maybe play a part of it. But I think as long as, you know, literally to make a pun of it, staying true to its roots, you know, we continue to focus on the diversity and inclusion in all elements of the business.
You have another question for her, Melissa?
Certainly, I think she touched on it, but I'd love to hear a little bit more when you talk about the regulatory bodies and the hemp industry. Who do you think will be regulating in the future? I mean, what should companies do to prepare?
So right now, cannabis, the hemp side especially, is widely unregulated. So there aren't any standards right now for testing, food safety standards, anything like that. Even OSHA, they will knock on a door and go into a facility if there is a complaint, but that's the only time that they really get involved. Right now, I would say 90% of the industry is not ready for future regulation. In fact, when I do like an FDA audit, because our company covers FDA, OSHA, Fire Code, we do GMP certification and ISO certification assistance. Those are all things that aren't regulated. They don't even exist. So all of our clients are voluntarily trying to be proactive and get into compliance before they have to, because once the FDA starts coming in and OSHA starts coming in, there's going to be a huge paradigm shift. People won't even know what hit them. And most facilities that I do a one-time audit in, because that's one of the things we do, we just show up, we do an audit, we give you a report and tell you how you're doing, and then you can make changes however you would like. And most of those audits, if I were an FDA regulator, I would be closing that company. I would be making them write a cease and desist and shutting their doors for things that seem very small, but are really, really big when it comes to FDA regulation. So like enough hand sinks in the facility, or having hot water, or cross-contamination issues within the facility. So there's a lot of things that are going on that, people in this industry aren't educated on, because you just don't know what you don't know. Not everyone is a food safety specialist. Not everyone is a certified quality auditor and knows, what those audits look like and what to expect. So, just educating yourself. And like I said, our clients are some of the best in the industry. They've reached out and they're getting compliant right now, so that when all that regulation starts, they're going to be ready for it. So
I think that's so important. I'm sorry, Charles. Okay. I would just say, because I'm ServSafe certified as well, and I don't think people really understand, especially when you're talking about edibles and you're looking at the food element of this, what kind of safety regulations need to be put in place. And the fact that they aren't is actually terrifying.
So keeping your regulator or ex-regulator hat on, I wanted to focus on two questions. My first question, and then I'll let Dr. Shaw jump in too. My first question is, a lot of states are going in with social equity requirements for licensing. And as a regulator, and also knowing that a lot of the minorities and women aren't getting in America aren't getting their fair share. What do you think about the social equity programs that are in place now?
Well, I think that they're really great. It's a first step forward in trying to do something. At least the government and the people who are writing these regulations and proposing these kinds of things are thinking in a way that makes sense. Social equity is really, really great. Sometimes the programs have weird things that are happening in them that actually prevents it from happening. And they've had issues with, people having someone on their board of directors, or as an owner that's never even been in the facility and they're the only minority on, things like that are happening a lot. And there are always people out there that are going to cheat the system, and that's just the way it is. But I do think that the fact that states and hopefully the federal government, when it all becomes federally legal, are thinking about those kinds of things. Because if we can give a leg up to those minority populations, I think overall our industry is going to be better for it. We need diversity. With the drug wars and everything else, it's better for us to have people who have been through that, because there's a history there that we don't want to forget. And if we whitewash the entire industry, that history is going to be forgotten, and a lot of what makes the cannabis industry will be lost. So I think it's really great. There will always be loopholes, and I hope that the people who are writing these social equity laws are really focusing on these are the types of groups of people we want involved. How can we get them involved, and not have them just be a name on a piece of paper? How are they going to actually be in there and run the facility and start to live that American dream that everybody always talks about, but has been so hard for a lot of our minority groups to be involved with. So I think that should be where the goal is.
Thank you. And my last question, I've been to a lot of the hemp and cannabis conferences and getting my education down. And one common theme I hear, and looking at it as an investor, one thing that I was really concerned about is crops going hot. For example, when you're growing hemp, you need to be under the 0.03% THC level. And if you go above that, in a lot of cases, you got to completely destroy the crop. And I've heard about different remediation techniques to take the THC out, and then I've also heard that if the regulators don't want the THC moving off of the property, that trucks with the equipment on it can come in and take the THC out of the product as well. With your regulator hat on, or your ex-regulator hat on, what do you think about remediation?
So I was actually on the CHAMP initiative in Colorado to write their hemp plan for the USDA. So the regulations that you're speaking of are the USDA regulations. And the issues that most people are having is that most states, that 0.03% THC was for the activated THC in the plant. So they would test the activated, just THC, not the THCA in the plant, while it was still in crop. And if that was below 0.03%, then they were good and they can move ahead and sell it. What they're running into now is the USDA is saying total THC. So that includes THCA, and for most strains, that makes it much, much higher. Most people can't even keep below that 0.03%. So they're having to test a whole lot earlier and harvest a lot earlier, because it will actually, increase that THC amount the longer it grows. And so, it is a really rough thing, and it's a hard number to keep under. People do have to destroy crops all the time, especially when they were transferring over to this new way of regulation. We actually, me and three other people, I think, on that CHAMP initiative actually got together and we all talked about the remediation. There is chemical ways, and chemists have done it for a long time, where you can take a CBD plant that has high CBD and too high of THC. People remove that THC all the time and dispose of that. There are people that can come and dispose of that for you, or you can dispose of it per your state regulations, your marijuana regulations, if you have any in your state. And usually that's okay with regulators as long as you're not selling it anywhere else. And then just take the CBD or CBG and CBN and whatever else you want and sell that instead. So I believe in remediation. I think that it should be allowed. I also believe that when a plant grows, if it goes above that THC percentage, I think that the farmer should be able to sell that crop to a non-consumable company. So if you're making hempcrete or fiber or paper or clothing, the THC level shouldn't matter at all. So they should be able to cut down that crop and send it to somebody else that can process that into something that is non-consumable. Or they should be able to take that crop and put it into a facility, extract that THC, dispose of that THC properly, and then still be able to use the crop. And this is something that I've talked to numerous regulators about, and they don't always see eye to eye with me. And I think the reason for that is they think that somebody's going to take that THC and sell it on the black market, which does happen and has happened. But I believe that there's a way to write regulations to prevent that from happening. And that is a whole other can of worms, and that'll take hours to talk about.
Well, it sounds like you're thinking with common sense. I know I certainly wouldn't want to be a farmer knowing that I could have to destroy my otherwise all healthy crop. And as an investor, I certainly don't want to invest in a product that can just have to be destroyed and I lose all of my money either. Dr. Shaw, do you have a question for Kim?
I just wanted to kind of build off a lot of the discussion so far because she's raised a lot of interesting points worth commenting on. First of all, if we go back to kind of the general regulatory piece, there seems to be this trend that when a new industry develops, there's a lot of bad actors that tends to lead to one or more events that trigger the need for, the regulatory bodies like OSHA, FDA, et cetera, to jump in and say, hey, you screwed up, so now we get to regulate you, which then tends to go to the point of overregulation and also favor a lot of deep pockets that can fund the appropriate regulation to their benefits, where the small guy is going to suffer far more and can't compete. So I think it would behoove the industry to try to really clean up their act as quick as possible to prevent some major event occurring that would justify these agencies to really get involved more than they need to. Then moving on to the pharma piece, pharma that is, I agree with Kim completely that this is going to be a battle, and you're going to hear me talk about it on episode after episode, that we really need to empower people to really kind of adopt some degree of their own research and scientific method, that they would kind of consolidate their own experiences. And if we can then take all this information and put it into databases, it's going to be very helpful to try to combat a lot of this proprietary kind of element that the pharmaceutical company likes to use, where they'll do clinical trials on a specific type of condition and then get all kinds of protection after doing that, and try to appropriate it away from its normal use. For example, if I'm already using topical CBD and THC blend, that I get in a dispensary, and it's working well for pain, muscle pain on my arm or leg, and then suddenly down the road we have a pharmaceutical company run the trials through this FDA machine, and suddenly then you find that regulators are pulling this stuff off the market because only this is only by prescription now, supplied by one specific pharmaceutical company that enacted these trials. And lastly, with regard to this remediation effort, to me, it kind of just betrays the whole, lack of logic applied to this debate. That when we're talking about 0.3% or below THC, and then we're going to generate in mass quantities all these hemp-related extractions, and then eventually, just by sheer production, we're going to have so much pure THC. And then we're looking at that like it's this most evil thing, and how do we get rid of it when, in and of itself, it probably has some degree of medicinal benefit. Not to mention, it's okay to have, close to 100% alcohol that's sellable in some states for people to consume, or, all the narcotics, et cetera. I feel there has to be a lot more kind of outcry against that. Like, at what point are we going to realize that this THC-based molecule really stops needing to be demonized,
Thank you, Dr. Shaw. Boy, do I agree with you. So, Kim, when we come back after this commercial message, we're going to switch hats, and we're going to go from regulator hat to compliance consulting hat. And I look forward to hearing about all of that and what you do and what you've seen out in the marketplace as well. So see you right back after this commercial message. And welcome back. Kim is back with us, and now we're removing her regulator hat and putting on her consultant hat. And let's just start off. So, Kim, tell us a little bit about your background and what are you doing now?
Yeah, so I worked as a cannabis regulator, like we already talked about earlier. I learned a whole lot about cannabis. Thank God that the industry was so welcoming to me and taught me pretty much everything I know about extraction and all of that. I come from a food safety background, so I was a restaurant and wholesale food regulator before I got into the cannabis industry. And then in Denver, in I believe 2014, the beginning of 2014 was when recreational became legal. I started working as the cannabis regulator for Denver County. And it was a really exciting opportunity. I wanted something different. I was tired of restaurants. And I thought, I have to do something different. I can't just be a regulator. I need to help these people, and I need to help them keep their companies going for a very long time, so that they, can live their best life. And I need to make sure that the industry has safe products, because generally what we saw were major issues. In fact, I disposed of $28 million in the cannabis industry in just 2015 alone as a regulator. And that was just because of pesticides mostly. So, in the beginning when they wrote regulations, they didn't even think about pesticides on cannabis because it was a whole new industry. And later we found out pretty quickly that there were some very nasty pesticides that are actually carcinogenic when combusted and inhaled, which is exactly how most people consume their cannabis. So it was a big deal. It was, a really rough job for a long time. And I wanted to be very ethical in joining the industry. So I went to the ethics board in Denver. I kind of had my plan, and I didn't want to work. I got offered several jobs to work for very big, really great companies in Colorado, but knew, when you're a regulator, everybody's dirty secrets, all the skeletons in the closet. You've seen everybody's processes, all that thing. So I felt like that was really unethical to leave in that fashion. So I started my own consulting company in 2017. So now anybody can hire me. I signed a very strict NDA with the city of Denver, just so that was off the table to tell anybody's dirty secrets. And I work under NDAs constantly. And it's been really great. We've built the team. We've got 3 consultants and then me, which I also do consulting, but nowadays I run the company and talk at conferences and things like that a whole lot more. We do FDA, OSHA, Fire Code, GMP certification, and ISO certification assistance. And right now, we have some of the best clients in the world because they're really getting ahead of the curve, and they're becoming the best of the best in the industry. And we work in all 50 states, Canada. We've had clients in Israel and Africa. It's been kind of crazy. It's not what I expected at first. I thought it was just going to be me by myself, all by myself. And it turned out the need was a little greater than I thought. So I'm really happy to be here.
That sounds amazing. You talked a little bit about what you do, but for an investor coming in and companies looking for investment, how does Allay Consulting help with that?
Yeah, so great question. That's actually a side of the business that I didn't think was going to exist. I didn't even think about it. I thought, companies will hire us and we'll help them. But there's a lot of things that we do that I didn't originally think we would be doing. And one of the things is the investment side. So we have a lot of investment groups that hire our company. Even financial companies that are loaning money to the industry have us come and do audits for them. Due diligence is a very, very smart thing to have on your side. Understanding what it's going to take for them to be compliant in the long run. If you're giving a company $2 million and they're out of compliance, that's a really big deal for exactly the reasons that I previously stated. Regulations and regulators can ruin your business. In fact, I saw several businesses go under simply because of recalls and disposals that my department did. And it was just really heartbreaking. So if you can get ahead of the curve and hey, I'm going to give these guys this much money, or I'm going to buy this facility, I know exactly what I'm walking into and what it's going to have to take for it to be a long-term investment. I think a lot of people just go, oh, it's cannabis, it'll make money. And that's not the case. And in fact, now even more so because of how much competition there is. In fact, I was at a pitch competition in Texas not that long ago, and one of the investors that was up there talking said, don't worry about compliance. If you don't need it, don't worry about it yet. Just invest. And I felt like that was the absolute worst thing that they could say, because I've seen so many people invest and not think about it. And then they find all these huge issues, and it costs them even more money to even keep the company going. And 90% of the time they lose everything. So keep that in mind. We do that due diligence. We do desk audits. Most of what we can do is even remote. And then we do on-site audits as well for GMP and FDA and OSHA, just to make sure, and there will always be things wrong. Not every company is going to be 100% perfect. But if you can identify these are, the $50,000 to $1 million problems, and these are the $100 to $200 problems, and being able to be like, okay, if they only have these lower level problems that are easy to fix, then you'll be okay. It's really identifying those big ones that you really want to identify.
Budding Capital runs pitch contests, and we did one in Texas, and I can assure you that I would never say that compliance isn't important. So I hope that was a different pitch contest entirely. But as an investor, I went out and I looked at a lot of different labs and a lot of different grows and all. I know you've signed NDAs, so we certainly won't say any names. But what are some of the horror stories that you've seen out there when you've done compliance checks?
Oh my goodness. That's a whole lot. And no, it wasn't, I don't think it was your pitch competition. I go to a lot of them. But recently, this is a really good one. One of my consultants was on site at a facility and came across some test results, right, that were really, really high in the flower. It was at a grow in lead. And heavy metals are a really huge problem in the CBD industry, mostly because nobody has to test for them. That's not required at this time. And it's a bioremediator, right? So if you buy a plot of land that used to be used for mining or something like that, and you plant your crop, all of those toxins and heavy metals are going to be pulled out by that plant. And it's a great bioremediator. So, it's great for that. But at the same time, if you're going to sell it as a consumable, you can't have those toxins in your flower. And this was an indoor grow. So it made literally no sense. So they tested the soil, they tested all the stuff. They couldn't find where this lead was coming from. And my consultant found out that it, decided to start testing all this other stuff. She found out that it was actually in the nutrient for the plants. They started using this new nutrient out of nowhere. They were just trialing it. So it was even, a small crop that was affected, but still, at least they noticed and tested. But yeah, the nutrient itself had a really high level of lead in it. And so those are the kinds of things that will blindside you and not really make you like, oh my God, how were you ever going to know that? But lead contamination is a really big issue right now. There's a whole lot of articles coming out of places that have high lead in their tinctures and things like that. And it's been a common issue for a really long time. The other thing that I find, or some horror stories that I found, is people making like extraction equipment in their garage and it not being like UL rated and things like that. And one time we found this shatter and wax that was like a really gross, like rust color. And we couldn't figure it out. So we kind of looked at it. We were actually in for pesticides. And we look and we make them open their extractor. First of all, they were not cleaning or sanitizing their extractor in between anything, which is a huge deal. And then on top of that, the inside of the extractor, because it wasn't stainless steel and it wasn't a UL listed extractor and it was just homemade, was completely rusted out on the inside. So essentially people were taking these concentrates that were, 40% rust particles and then, dabbing them into their lungs. I guarantee you, I'm no doctor, but I guarantee you that is not good for your health. So there, weird things like that are what I've seen. I've found shatter and wax and dabs of all kinds that are like 56% myclobutanol, which is a very dangerous pesticide. And one of the things that it makes is hydrogen cyanide when it's combusted. There's just like really crazy things. And I think that consumers don't understand how unregulated these things are. And they don't know how to look at one product for the next and know if it's safe or not. And really, I want to make it so that we can tell that and, have people get certifications and, get into compliance and all that kind of stuff, because product safety is a huge, huge deal in every other industry. And it should be in this one as well.
Well, meeting you has been fantastic for me as an investor, because I will not make an investment in a company that you have not reviewed it and that they don't use you on a regular basis, because there's just so much to pay attention to and so many problems that can run you out of business. And I want to avoid that. And I want the entrepreneurs that I'm working with to know that too. Dr. Shaw, let me throw it to you for your thoughts and any questions you might have. Dr. Shaw, I don't have sound on you.
I apologize. Kim illustrates in disturbing detail what I was discussing earlier, with the idea that you have a handful of bad actors doing these types of practices, and it really poisons the well. And it's incredibly frustrating to me that it's this repetitive process in every new industry that you get people in there that take shortcuts and do anything they can to kind of maximize limited return, not see the bigger picture of what their efforts are causing. And more power to Kim and other regulators that want to go at this in a very objective way. But gosh, I wish I could just strongly discourage anyone from kind of getting involved in this any further and doing this kind of stuff, because it ends up being destructive for everyone. There's going to be more regulation than's necessary. And at the same time, as I said before, the big players are going to use that to their advantage to squeeze out the little guys that we're doing everything right. So let's hope we can really find a way to kind of cut out this kind of nonsense that's going on before, something really bad happens. Like if you recall some of these tryptophan poisonings that occurred back in the day with these compound pharmacies, and how then that enacted a whole overhaul of compound pharmacies across the country. And maybe there needed to be some degree of oversight, but I think some of those pharmacies actually can do a lot of benefit. Now it's very tough to find one, let alone start one.
Thank you, Dr. Shaw, and thank you, Kim. That does bring us to the end of our time today. I feel like I could go on and talk for hours with both of you. This has just been such a great show. I have plenty more questions, so I know we can fill another show at another time. Let's put up Kim's information so anybody can reach Kim that is interested in consulting. So this is Allay Consulting. Kim Struck is the person, and if you're an investor or a grower or in the business at all, you really need to reach out and make sure you're doing things right now before the government comes in and shuts you down. Join us next week as we discuss more up-to-date cannabis news and are joined by Super Bowl champion and cannabis advocate Marvin Washington, as well as a special guest discussing the difficulties of cannabis-related convictions, Robert Cartier. So please join us. Sounds like a super show next week as well. Thank you for joining us on The Budding Report. Have a great day.